Hi, I'm Dr. Dan George, reporting today from the Euromigos Live meeting in Nashville, Tennessee, and here to share with you my vision of where treatment will be for patients with metastatic hormone-sensitive or castration-sensitive prostate cancer in 2027. I think the current therapies today are going to continue to be used and be more comfortable, more prevalent in our practice in these patient populations, including our use of novel androgen receptor pathway inhibitors as well as docetaxel chemotherapy. I think what's going to change is our assessments of frontline patients. We're going to be doing standard now, not just bone scan and CT, but also PSMA. And we're going to be doing much more standard now genetic testing, both germline and somatic. And it's going to help us identify genetically some of these patients who may be enriched for certain strategies with PARP inhibitors, for HRR mutant patients, for pembrolizumab for patients that are MSI high, and maybe AKT inhibition for patients with loss of PTEN. Then I think we're going to have phenotypic profiles of patients that are very high on PSMA PET, that have disease that's primarily limited to node and bone. I think those patients we're going to target with PSMA lutetium, and I think that's going to be based on this new PSMA addition study, which will read out by then. And then I think we're going to have these patients that have a more mixed picture on PSMA. And I think for that population of patients, we're really going to gravitate towards the use of chemotherapy, particularly the patients that have high volume disease. For the patients that don't have high volume disease, low volume disease, there's going to be really kind of two groups. Those that have oligometastatic, where we can use kind of stereotactic radiotherapy to those mets. And I think there we're going to use just standard AR pathway inhibitors in ADT. So great time. I'm looking forward to the future. Hope to see you there.